Attention deficit disorder is a brain disorder where there is an ongoing pattern of inattention, impulsivity, and hyperactivity that interferes with your functioning, the daily activities, and development. The signs and symptoms of attention deficit disorder is general unattentiveness, and also the hyperactivity and the impulsivity part. In the unattentive part, you will see the generally not paying attention to the details, inability to finish the task after either in school or at work, forgetfulness, trying to avoid the activities which require sustained attention, and also general inability to finish the task. In the hyperactivity and inattention area, we'll see the people who cannot stay still, kind of tendency to squirm around, talk non-stop, have trouble sharing and waiting for their turn, get very impatient, always talk and continuously on the go. Those are the things you will see in some of the patients with hyperactivities. The diagnosis of attention deficit disorder requires teamwork, assessment by the pediatrician, assessment by the teachers, and assessment with the people who live with you, including the parents in the household. It has different scales which you can use in the adults and the children to assess the patients to make the diagnosis of attention deficit disorder, and also requires ruling out some of the other psychiatric and physical illnesses that might be mimicking the attention deficit disorder. Some of the risk factors for the attention deficit disorder include having the blood relatives. In your family, you will see more than one family members, either the siblings or the parents, suffering from the attention deficit disorder. Some of the toxin exposure during the pregnancy or exposure to lead has been known to be a risk factor for attention deficit disorder. Along with it, during the pregnancy, if the mother uses alcohol or the drugs or the premature birth, they have been connected with the attention deficit disorder. In most the cases with attention deficit disorder, you do end up using some kind of medication. The same medication does not work in all the patients, and once you start with the medication, that doesn't mean that you have to stay on the medication lifelong. And more importantly, the medications should not be used in isolation. There are a lot of other things that need to be done in combination of with the medications to have better outcome with the attention deficit disorder treatment. I think there have been more emphasis on the medication than we should. We should use the medications in combination with some of the other things we can do at home and in school. The proper nutrition is very important. Mixing the right snacks. Some people say that giving the snacks to the child or the student every 3 hours. Having little protein and mix of complex carbohydrates in the diet can go a long way in helping with the symptoms of attention deficit disorder. Maintaining the right weight, keeping the regular sleep pattern, along with the help of the pediatrician, checking the zinc, iron levels in the blood of the child is very important. Sometimes that can go a long way in detecting that there might be something physically that can be done for the student. And along with that, some supplement. People have used omega-3 fatty acid, mix it with the diet, and that has been beneficial. So it's very important to don't just depend on the medication. Generally, the answer to that question is no. You don't grow out of attention deficit disorder. Majority of the patients who have been diagnosed to have attention deficit disorder go on to continuing having the symptoms in their adulthood. Sometimes now we are beginning to see that the patients get diagnosed when they're adult with attention deficit disorder.